Hello, I am Dr. Djevalikian, and this is for the Art of Medicine Online.com. Have you ever wondered what if your diagnosis did not matter? What are people's basic needs when they want to see a doctor? The obvious is to be diagnosed and treated. Other, less obvious needs are to be validated, reassured, enlightened. The question I would like to raise is how much of the cure comes from addressing these other needs alone? In other words, what effect do needs such as validation, reassurance, and enlightenment have on a person's recovery before even making a diagnosis? A purist will say they have no effect. Unless you treat the illness, everything else is irrelevant. One could die or become gravely ill from failing to diagnose, no matter how compassionate a doctor is. But how effective is a treatment if it fails to acknowledge the person as a whole? Physicians often feel that by providing patients with a diagnosis and treatment, they have performed their duty. Have they? When you think carefully about this, what do we doctors truly offer patients if all we give them is a prescription, a treatment? The answer is we give them a solution to their problem, but what if the problem has no solution? What if the solution does not address the problem, does not address your problem? This is a radical question because it puts into perspective several assumptions. The assumption that your diagnosis is always accurate, that your treatment is always effective, but most importantly, the assumption that patients only seek a physical cure. We forget that equally important is the notion that patients also seek reassurance, hope, or a simple explanation, and nothing else sometimes. Imagine you're a builder, and during the process of building a house, you're alerted of a problem with the foundation. The clients are made aware of this, and they are highly concerned. You investigate the problem and you find it requires changes which you address and then complete your construction. When you hand in the keys and they ask you about it, you tell them, "Don't worry, I took care of it," as you truly have. There is no problem with the foundation. But they have not seen you fix or address the problem, and they are consumed by this preoccupation. Now, I'm not sure what would be the equivalent in medicine for this, but one example is the resuscitation of a cardiac arrest patient. It is sudden, often unexpected, emotional. It is complex in that all organ systems are stretched to their limits, and the margin for error is slim to none. This is it. That moment we have all done everything to avoid is happening, and unless we do something, the patient will die. I would say that's pretty complex in all its facets, medically, legally, psychologically, emotionally, financially. We used to hide the whole process from patients. Too much room for error. They should not witness this organized chaos. They can't handle it. It's too intense. But studies have shown that allowing family members to watch cardiac arrest resuscitation efforts does not increase the likelihood of lawsuits or change the patient outcome in a negative manner. Families are almost always satisfied. They see with their own eyes a team of 20 people in action, doing everything they can to bring their loved one back. The American Heart Association encourages physicians to allow at least one family member to witness the code of a loved one. Try to hide it from them instead and see what happens. After ending your code while the family's waiting impatiently, come out and say, sorry, your daughter did not make it. It's disbelief. What did you do? What happened? What do you mean she's gone? You incompetent fool. But when they see the process, they understand the effort, even if they may not understand the medicine behind it. Patients are reasonable and almost as ready as you are when you must pronounce the patient deceased. I mean, what could be a worse outcome, right? Yet, they understand. Now, back to the builder. What is more real? The reality that there is no problem with the foundation, or the reality that clients still believe there is one? You, the builder, have done your duty. You have consulted a team of architects. You've revised the plans, building codes, redirected your crew, and fixed the problem. You've resurrected the building. But the clients do not know what you've done. And they've not witnessed the efforts you have undertaken. For years, they will question the structural integrity of this foundation. Everything that happens to this house, they will blame on this foundation. And you? You feel as though you've met your obligation. And frankly speaking, you think your clients are being unreasonable. Bunch of fools. If they only knew what I did for them. Yeah. If they only knew. Back to medicine. Let's assume for a moment that the diagnosis is correct and that the treatment is appropriate. What are we treating? Are we treating the illness or are we treating the patient? We often forget that we're treating the person who's carrying the illness rather than the illness alone. I mean, the person cannot be separated from the illness. This person is also one with the intangible, such as insecurities, disbelief, innocence, past experiences, dreams and aspirations, responsibilities, intellectual limitations, or genius. Though the builder fixed the problem, in the eyes of the clients, he did nothing. It's as if he had done no investigation, no consultation, no modification. At the beginning of this presentation, I implied that your diagnosis and treatment do not matter. Of course they matter. But when you fail to comfort and to give hope, when you fail to communicate and to explain, to the eyes and mind of patient, nothing matters. It does not matter because it's as if it was never done. None of the blood tests and x-rays ordered have any meaning. Just as they're meaningless to you, the physicians, before you see the results yourselves, right? It's like beautiful French poetry that touches the core of one's existence to a person who does not speak French. It may sound beautiful, but it's meaningless. And to a patient, when an illness continues to exist in the mind, it exists. And all of the steps taken by the physician will be meaningless. Now let me make one thing clear. I believe in my profession. It is better than ever now that it is evidence-based. However, it is imperfect. It is imperfect in its science, and it is practiced by humans, imperfect beings. Thus, the diagnosis may be inaccurate. There may be no diagnosis, or the treatment may be inappropriate or fail to change a disease outcome. But if you treat the person together with the illness, you add to this beautiful yet still imperfect science the type of precision that only an artist can interpret, like a physician who practices the art of medicine by instilling hope and keeping it alive throughout the entire patient experience. Until a cure occurs, only hope exists, you know. What keeps hope alive? This is an open question. This hope should exist from the moment patients walk through the door of their hospital or clinic to the moment they walk out. Physicians should thirst for a type of encounter where healing begins from the instant they lay eyes on their patient, or when a nurse says hello. A desire to heal is also to question what, when, and in which manner patients are told anything by anyone involved in their care. It is to be doctored and nursed in the true sense. It is to remind everyone that healing occurs gradually and throughout the entire patient experience rather than at the end when you're handed a diagnosis. And that a cure alone, coupled to indifference, renders impotent the most powerful act entrusted to humans, which is to heal. So, be a real man, a real woman, be a real doctor, and be compassionate.